Discovering that your child has retained primitive reflexes can bring both relief and concern. Understanding what this means and how to support your child development is crucial. I am Coca McDonald. I'm an occupational therapist. I am the author of Reflex Integration Through book series and program creator. Welcome to this podcast. I would love to share with you and also ease your concern when it comes to retain primitive reflexes. I've heard from a lot from therapists as well as for parents feeling so scared and overwhelmed when they first heard their child has this thing that they've never heard before. Their child has retained primitive reflexes. So let's start from understanding what this means. As a parent, when you first hear that your child has something, especially something you've never heard before, can make it bigger than what it really is. Of course, I'm not here to minimize the fact that your child has, retained reflex, or a specialist has assessed your child and telling you that there's a concern. Of course, you have to address that. But first, let's help you understand what this means. Primitive reflexes can also be known as primary motor reflex patterns, are these automatic movement present in infancy or even in utero. They're designed to aid early development. They're designed to be a survival mechanism that needs to be there in order for your child to learn to move later, to have voluntary movement patterns. So think of it as a foundation. Typically, these reflex patterns, they start to integrate in the whole body, meaning that as the child starts to move and this repetitive movement that all kids do when they're typically developing, the brain starts to learn brain-body connection and a more voluntary movement pattern starts to develop. So the child starts to learn the environment and learn what's happening, learn the body. They can move their body, they can reach, they can roll, and all developmental milestones start to reach, and they start to have sensory processing, regulation, and learning, everything else built on top of that. Typically, these reflex patterns integrate into the nervous system within the first year, sometimes even up to 3 years. Some of them are in the first year of life. However, when they start to persist beyond the expected age, they can impact physical coordination, emotional regulation, cognitive, and so on. So, for example, the grasp reflex, you probably have seen it when you first had your baby and then you put your hand on their hand, they grab you really tight. That's not because they're stronger, but this reflex pattern is making them hold really tight. It causes the baby to hold onto you, to hold onto an object placed in their hand. While the rooting reflex, for instance, is when you stroke your baby's face, they will turn towards the stroke, and then they'll be able to open their mouth and be able to latch on their breast and starts to feed. That is a survival mechanism. That's how the baby learns to latch and to hold on. This is reflexive. Kids who don't have that might have eating or latching challenges. And there's also other reflexes. They work together. So certain reflex facilitate each other and certain reflex work in opposite from one another. So the combination of all these reflex patterns helps us understand the world, move, survive the first year of life, and later learn to move intentionally. These reflexes are essential in the early life, but should diminish as voluntary control develops. So take time to learn about these specific different reflexes your child has retained. If your therapist says, oh, your child has these reflex pattern, we can visually see how these reflex patterns present in the way that your child moves and interacting. Learn about it, and understanding how these reflex affects daily activities will empower you to support your child's unique needs effectively. There are several adults who still have retained reflex in their body, and they learn to compensate, they learn to build, they learn to interact and have a typical life as well. You don't have to worry as much about it. This is to help you understand that now you're learning one layer down or even 5, 6 layer down why your child is having these different challenges. You're going from the foundational, from the bottom up. So you're learning what's happening in your child's body. So if you want to learn with us, we have resources for you. Feel free to download our app and learn there as well. That's one simple way you can start. And if you need support, reach out to your therapist. And if they're saying something to you, and ask them, what is it? And another thing you can do is assembling your support team. You don't want to do this by yourself. You don't want to do any treatment by yourself. If your tooth is hurting, you don't do it yourself unless absolutely necessary. For the most part, you will go to the dentist. If something happened, you go to a doctor. So treat this similarly and make sure that you have the right team around you. A knowledgeable support team is really vital. Occupational therapists trained in reflex integration can be invaluable partners in your journey. If you cannot find one around you, go online and find someone near you. We are collecting more of our featured therapists in our website. You can reach out to us and we can find one near you as well. Consult your child's primary care provider for referrals. Sometimes your doctors will know. When meeting potential therapists, inquire about their experience, because not all therapists are trained in all the areas that you want your child's needs to be met. So make sure that you ask if the specialists that you're working with have thorough training or understanding of that specific treatment that you want your child to get. So get understanding of how they can help you. Another part is setting realistic goals and expectation. Reflex integration is a gradual process requiring consistency and patience. Collaborate with your child's therapist to set realistic, achievable goals, such as improving focus, enhancing physical coordination, or reducing emotional outbursts. Learn with your therapist who can really assess your child. What is a realistic goal for your child? Where they're at. So sometimes it's not really about your child's age, should be your child's developmental age. Child can be a 10-year-old, but developmentally, if your child is 7-year-old, that's probably where you want to start and build up. And rushing through the progress in any treatment goal, you're not going to get the most out of it. So having a therapist who can really assess your child, where are they at, and be able to assess is helpful. And to some extent, have a specialist who can really help you understand your child's different abilities in different areas. So it is possible that your child will be really advanced on one area and really behind in another area. In that case, you can use their strength to work on the challenges they may have. So as we're working on as reflex integration, it's just one part of the equation to all the treatment your therapist will be providing for your child. It's not the one and all approach. It's just one modality, framework that a parent can use as a home program, as well as a therapist can use a home program. So getting that good idea of where to begin is really important to creating a realistic goal and expectation. Ask questions like, what changes might we see first? And how long before we notice progress? Celebrate small milestones because that is very helpful for you and for your child. It can be stickers with one child. It can be activities with another child. You know your child best, so celebrate each small wins. I know for me, sometimes I go from one goal to another, and it makes it really hard to stop and celebrate milestones. But when I do that, even with my own kids, it goes a long way. The small wins can be improved posture or better hand-eye coordination. It can be a boost motivation, highlight your child's development, anything. Make sure that you have a tracking method. Next one would be engaging in at-home activities. This is key because we are, for instance, running research inside our program and incorporating a home program. I've seen it before with our clients or therapists that we train. We have therapists worldwide that we train in this RITP certification program. And the parents who do a home program consistently, those kids improve. So now I'm not trying to add more stuff on you and make you feel guilty, as all parents always feel guilty for everything. But I'm just saying home program that a parent can do, even if it's 10 minutes, 5 to 10 minutes, the child who is adding those frequency will do way better than the child is just getting the once a week treatment session. So as a therapist, if you're listening, if the more you can have a home program, even if it's one exercise, is way better than none. So I highly, highly encourage that. Engage in at-home activities. There's a lot of things you can do. You don't have to be overwhelmed. You don't have to know everything. You can just do one or two things that your therapist is going to help you do at home because they know your child's best, and you can start there. Your involvement at home is really critical, and therapists can guide you in incorporating specific exercises and play-based activities that promote reflex integration, sensory integration into your daily routine. And consistency is key. Regular practice of these activities can significantly enhance your child's progress and support the work done in therapy session. Monitoring progress and adjusting strategies is also another key areas that you can do. So regular communication with your child's therapist specialist is essential to monitor progress and adjust strategies as needed. Keep track of improvement and any ongoing challenges to ensure the approach remains effective and responsive to your child's evolving needs. Think about it. If you're doing one activity, you want to see results. So usually parents or therapists say, like, how long before I see result? Usually you should see a result of your activity, and after 2 weeks and 4 weeks, you should definitely see some kind of change. If nothing, then switch to something else. Maybe that activity is not the best approach for you. You should be able to see something right away in a couple of sessions, in a couple of weeks, some kind of improvement, because the brain is constantly growing. There's brain plasticity. In other episode, we talked about understanding the why of these activities you're doing, because some of the activities might feel like a drill. Athletes do drills because that gets them to the goal of functional ability, a skill that they want to have. So sometimes the activities can feel like a drill. This activity, it seems silly that I'm doing this, I don't know, let's say cross scroll, right? It's very important in being able to cross right and left side. And the activity, my child is struggling with behavior challenge, sensory regulation, can't focus, can't sit still. But my therapist is telling me to do this silly exercise. If you don't understand the why behind it, the likelihood of you carrying it out will be very, very low. But if you understand it, and you'll be able to do that. One way to understand it more is to track changes in your child. Keep an open dialogue with your therapist, allowing timely modification to the intervention plans will ensure that your goal and the exercises you're doing are aligned. Sometimes the exercises that you're doing seem unrelated to the progress that your child is making, but actually they are. I'll give you an example. I was doing a home program online with a parent, and I was seeing this child doing specific exercises. I start to notice the child's coordination starts to improve, and she's doing really, really well. And then in another session, I talked to a parent. How is she doing? Where is she bringing out? How is her fine motor? How is her focus? What other changes are you noticing? The parents saying her swimming is getting better and she's finishing her homework way faster. Like, these are the things we were not actively tracking as our goal, but we can see because we were working on the foundation, all of a sudden other areas starts to improve. She's not overworking her muscles as much, so she's not as tired. She's not overwhelmed with the sensory input that she's getting anymore because she's becoming more efficient. Because of that, homework is not as gruesome anymore. She's finishing faster. She's understanding. She's not fatiguing. And then other areas starts to improve. And the only way we could have known, and even for me to know, is if I had to ask the parent and having this open dialogue and let me know what's happening. And then as a therapist, explain to her how this bottom-up approach, as well as that we do also top-bottom approach, is as effective for treatment as well. So sometimes we drill fine motor, whatever it is, that skill that you're working on from the top to bottom approach, and it takes forever because you're not really fixing the foundational challenge that the child is having. So in this approach, you can see that the parent was excited. I'm like, oh yeah, we're not spending that much time on homework. She's actually not fighting us as much and it's going smoother. And then we start to see different improvements. So having this open dialogue really is helpful for you. And monitoring progress is really helpful. Sometimes it can be that things might feel a little worse because all of a sudden the brain's trying to understand what is happening and it might feel a little messy. Just like when you're cleaning out the house, right? When you're moving around and trying to rearrange stuff, the room actually looks a lot messier first, right? So similarly, it might feel like that with the child's body. The tendency is to pull out. This is not working. Actually, something must be working to make that shift. So stick around a little bit more and keep at it before you completely pull out. When nothing happens, nothing changes, that's when you really want to shift the activity. But if you see it's a drastic change, then you are up to something. And I say, keep going and really get understanding how to go through that challenging piece of the intervention time with your therapist, some kind of modification to make it easier. Addressing retained reflexes is a journey that requires understanding, collaboration, and patience. It takes time for a therapist to have this clinical skill to be able to look at discover reflex patterns that can be triggered in play. Because during play, you're not looking at one, you're looking at all of them at once and how they come together and make it really difficult for the child to, whether it's to read, write, play, social interact, and access the environment. You're looking at everything at once. And that skill takes time for therapists to learn. And for you as a parent, it will take time to incorporate a home program, like any kind of routine you're trying to add in your life. Be patient with yourself, be patient with your child, and take your time and know that nothing happens overnight. If anybody's trying to sell you like, oh, get this and you get, overnight success or overnight shift, I'd be cautious. So just come in with patience by educating yourself, assembling the right team, support team, setting realistic goals and expectation, engaging in constant at-home activity, even if it's 5 to 10 minutes, and maintaining open communication with your therapist can empower your child to reach their full potential. Remember, progress may be gradual, but each step forward is a victory worth celebrating. You're not alone on this journey. With the right support and dedication, positive change is within reach. And play is a child's occupation, so we can do it in a play-based approach. Just ask your therapist how to do this and get support, get resource. For more support and more resource, check out our site, ritp.info. We have resources for parents. Get the app and look around and see if you like it and implement with your child. We have videos curated, a done-for-you program. Then you can start implementing as well. You can implement it as home program and classroom work for educators and teachers. If you're a therapist, you can use it as a clinic and your clinic as well. Give you ideas and create a home program and share with. They can create treatment plans as well. You can create playlists. So we're creating all these resources for you. So make sure to check it out for more resources. Thank you so much for being here today. If you find this helpful, share with other people and subscribe. Talk to you soon.